This presentation is about digital health security. As medical data is of enormous commercial value, healthcare cyber attacks on medical websites that stores patient data records are on the rise, as evident in other sectors of the economy. The three main cybersecurity regulations are the 1996 Health Insurance Portability and Accountability Act, or HIPAA, the 1999 Gramm-Leach-Bailey Act, and the 2002 Homeland Security Act, which includes the Federal Information Security Management Act. These regulations mandate that healthcare organizations, financial institutions, and federal agencies should protect their systems. If a patient's health data is shared without their knowledge through breach security, legal actions may result. Patients may choose to withhold their health information due to lack of trust of the electronic data sharing, and their treatment may be compromised, leading to life-threatening consequences. The essence of digital health information is to add value to health outcomes, decrease cost, improve quality of healthcare delivery, and improve patient data organization. An electronic medical record is a platform to organize and secure patients' health records and is a tool for medical personnel and policymakers. The Office of National Coordination for Health Information Technology defined health records as not just a collection of data you're guarding, it is life. There is a need to engage in policy debates to safeguard digital health privacy and regulate usage of patients' data for commercial purposes while enabling transparent data sharing for research. Four major ethical priorities for EHRs are privacy and confidentiality, security breaches, system implementation, and data inaccuracies. To implement policies and security measures by healthcare personnel to prevent digital health security breaches, they include educating users not to share their ID and passwords, and log off when leaving a terminal after accessing patient data. The encryption of patient data in cases of theft or unauthorized security breaches of storage on devices such as laptops, mobile devices, when they're lost or stolen. Implementing usage of cloud storage that is password encrypted to curb uses of mobile device storage, data security breaches, especially through mobile health. Leadership and stakeholders. The role of the CIO, or the leadership in digital health security, is about how organizations can take steps to ensure that patients' information is safe from breaches and no part of the health record is compromised. Healthcare information leadership plays a major role in supporting security strategies. Healthcare information leadership should implement methods for staff training and assess the needs for data protection. The government's role is to protect stakeholders. The government has enacted the Health Insurance Portability and Accountability Act, or HIPAA, and an important provision of the law is that any business associates or healthcare organizations' third-party vendors will be fined if they intentionally violate privacy laws or compromise patient health information. Also, the Department of Health and Human Services, a governmental agency, is aiming to establish mechanisms for multi-stakeholder priority settings. The government also, through the National Institute of Standards and Technology, has laid out guidelines for federal information security management. Electronic health records provide many benefits. They provide reduction in costs, improved quality of care, the promotion of evidence-based medicine, record keeping and mobility. These benefits are achieved by data completeness, resilience to failure, high availability, and consistency of security policies. The three fundamental security goals are confidentiality, integrity, and availability. Confidentiality refers to the process that ensures that information is accessible only to those authorized to have access to it. Integrity refers to the duty to ensure that information is accurate and is not modified in an unauthorized fashion. Availability refers to the property being accessible and usable upon demand by an authorized entity. Confidentiality and privacy. Health information is the most confidential type of personal information. Privacy is to control the access of data from unauthorized persons. Security and privacy in EHRs can be seriously threatened by hackers, viruses, and worms. Features in EHR systems increase data protection. Access to EHRs is vital for patient care and improving the health system. Access of a patient's EHR from several sites cause concern. Access to EHRs in the face of security defects could cause unauthorized disclosure. Access to EHR information by administrative staff without the patient's explicit consent is an example of unauthorized access. EHRs use security and privacy features as suggested by the International Organization for Standardization, or ISO. This standard addresses the information security needs of the healthcare sector. The standard also has guidance to reduce the number and severity of security incidents. This standard provides clear, concise, and health-specific guidance on the selection and implementation of security controls. The protection of patient privacy. In using anonymization and encryption, those are two tools that are used to protect patients' privacy in EHRs. We also must control access. We also must monitor who's using EHRs. And as a non-technical method, education and training for the staff can be used to follow HIPAA guidelines. Standards and regulations for EHRs. The most frequently referenced regulation is the HIPAA. The HIPAA is a federal law which protects health information. The HIPAA ensures that patients have access to their own medical records. The HIPAA gives responsibilities to those in charge of protecting this information. EHRs allow structured medical data to be shared between authorized health stakeholders. Confidentiality in an EHR. A proper encryption scheme must be introduced in order to achieve confidentiality in an EHR system. Username or identity with an associated password have been the most commonly used authentication. The most frequent data authentication method in current EHR systems consists of digital signature schemes. The HIPAA Security Guidance Report advises a two-factor authentication. It's really an authentication that has two methods, whether it's something a person knows or whether something a person can be recognized by through a fingerprint or face recognition. Security breaches. Security breaches may be subject to the return of EHR incentive payments to the government. Security breaches can result in lawsuits from patients and damage your reputation. Security breaches can cause an investigation by the Office of Civil Rights. Digital health security practices. Large healthcare organizations can hire security consultants. Smaller healthcare organizations can get data security from vendors and local computer service companies. Healthcare organizations should mandate employees to follow security policies and procedures. Healthcare organizations should sanction employees who violate HIPAA. Healthcare organizations should also encrypt all data. In conclusion, providing digital health security is imperative for maintaining a safety net for the patient's health, record sharing, regulating usage for research, and preventing breaches of sensitive health information. The CIO of digital health security plays a major role in integrating the most recent policies of maintaining a secure healthcare network and also have a role in ensuring all staff members comply with standards regarding usage of EHRs. The government has several laws in place such as HIPAA to assure that healthcare organizations comply with digital health security. HIPAA also has provisions for the use and storage of patient electronic health information. Policymakers such as the National Institute of Standards and Technology research and establish guidelines that ensure healthcare standards of digital health security by facilities and organizations.